Occupational therapy is a form of rehabilitation meant to help people across the lifespan participate in the things that they want and need to through the therapeutic use of everyday activities. To see how many people in our community knew what occupational therapy is, we decided to ask.
So what is occupational therapy?
What is occupational therapy? I'd rather give you an example.
Okay.
How about an intern? Is an intern a type of occupational therapy? No.
So if you get carpal tunnel syndrome from working over the computer too much,
Yeah, that's a great
stiff
example.
neck from leaning over the computer all the time, bad back, poor posture.
Well, it's almost like physical therapy. I would say if someone is hurt at their job, either through workman's compensation, you get them back into the workforce as soon as possible. You may have to go to the house, or you may have to go to a health clinic or a rehab center. Get them back to work as soon as possible.
Occupational therapy? Never heard of it. I have no idea what that is. Therapy, like in your workplace, provided by your workplace, by your occupation? I don't know. That's what I would guess.
What is occupational therapy? I know what therapy, but occupational.
Therapy is teaching a person how to live life again, like cooking and cleaning and washing clothes.
Never got that cooking and cleaning. This is occupational therapy. See what I'm wearing? This is therapy. What is?
What it is. I don't really have a guess either. Therapy sounds like, I always think of physical therapy, so that's all that I really know.
Occupational therapy, a specialized therapy for individuals with problems with movement disorders, hand problems specifically, more so than others.
Therapy and occupation.
More organized therapy.
Help them discover their occupation.
Occupational therapy is a therapy that helps you overcome any kind of injury that you've had dealing with muscles, tendons. I'm not sure about bones, muscles and tendons. And I had rotator cuff surgery on this shoulder, and I went to therapy for 6 weeks. And my husband had 2 hip replacements and went to therapy.
For about 6 weeks each time, and the hips are better than ever. And if you don't do the therapy, you're not going to get well. That's a guarantee.
The therapy.
Yeah, but now, what's the difference between occupational therapy and... occupational therapy helps you get along better in your world, right? Helps you.
Oh, well, I was wrong.
Around the house, or getting in and out of a car, going grocery shopping, at your job, like how to slice, or get in and out of a car, take care of yourself. If you have been injured in some way or missing a limb of some kind, anybody else want to chime in?
She's doing great.
She's doing great.
It is for people who have been injured, being able to do the things that they once did, like eating.
I think occupational therapy is, I don't know, it can adapt to any type of occupation.
Life skills, like muscle strength. Yeah.
What do you think?
My sister's a speech pathologist. That's occupational therapy.
What I think it is, it's reteaching people who've been in accidents or who have problems before, but learning to do normal everyday things like, pulling your pants off, buttoning your pants, eating, drinking, like doing motor skills therapy, stuff like that.
What does occupational therapy mean to you? I don't think he knows.
Okay, I think that, I don't really know what OT does. But if I had to take a guess, I would say that they do functional stuff, and they get certified in hand therapy.
Yeah.
Occupational therapy focuses on a function of what the patient has to get back to and a lot of the emotional part of it, I think. I don't really know.
As part of AOTA's Centennial Vision, it is our responsibility to ensure that we distinguish ourselves from other rehab disciplines by clearly defining what we do and therefore making ourselves widely recognized and powerful.
Failing to advocate for our profession is failing to advocate for so many members of our community who benefit from our services.